Hello, my name is Neil Boudville and I'm Professor of Medicine at the University of Western Australia and Head of the Division of Internal Medicine. Welcome to the first episode of the Long Case Teaching Series. Today I will be telling you what a long case is, why we at the medical school at UWA believe it is important, some of the pros and cons for this particular assessment, and then describe how the skill will be taught and assessed in internal medicine at UWA. Further episodes in this series will then build on this one, providing you with the basis to perfecting your long case skills. So what is a long case? The traditional long case has been used to evaluate medical students for over 150 years and has been a cornerstone of student assessment in this medical school for its entire history. Back when I was a medical student at UWA, it was one of the key barrier assessments in final year medicine, and so was taught and learnt to a very high skill level. The best analogy that I've read of what a long case is that it is an organised discussion between two doctors, typically a junior doctor discussing the points of a patient they have seen with a more senior colleague. In terms of the final year long case assessment, and similar to future specialist exams, the long case consists of three components. The first part is where the student spends 60 minutes with a patient they have never met before, taking a full history and doing a full examination. The second part is where the student spends 10 to 15 minutes formulating their thoughts and managing plan without looking at any medical records or test results. This is a key part. Do not look at the patient medical notes or their medical records or any test results. The final part of the assessment is where the student undertakes a mature discussion with an assessor, presenting the history, examination, and their problems, followed by a discussion of the issues raised. This last part typically takes 20 to 30 minutes. So what are the negative aspects of a long case? There are logistical issues that can make this assessment a difficult one, as you are seeing a sick patient often within a busy hospital system, where you may get interrupted for any number of reasons. However, probably the biggest negative aspect of the long case is its unreliability. And by that I mean it is an assessment that is very difficult to standardize. Different patients have vastly different needs and demands from one another. Different assessors ask different questions and mark differently. As such, any individual student may receive quite different marks from different examiners for the same patient. And different patients have different levels of complexity and so will provide different experiences for students. What are the positive aspects of the long case? It is authentic and valid. By that I mean it is more like real life as compared to the OSCE, which uses simulations, fake patients, and contrived situations. The long case also provides a much more holistic patient assessment compared to most other assessments because of its length and completeness. In addition, the feedback given on a long case from a senior clinician provides considerable educational value for the student. We could try increasing the reliability of the long case, but this would mean that this individual student will have to take more cases, which we neither have the time nor the number of assessors for it to happen. A recent Australian qualitative study published in 2020 examined the long case. It had some great quotes from students and examiners. One of them included from a student, "It's like all of medicine. There's two types of study. There's study for the exams and there's study for being a good doctor and a competent doctor. And the two don't necessarily seem to match up. I do think the long case, falls into the how to be a good doctor as opposed to how to do the exams well." Another student was quoted to say, "I think there is no substitute for it. You can't really assess it in any other way as comprehensively as you do in the long case." Examiners were quoted to have said, and I'm going to particularly stress this first one, which is a strongly held belief by many of us in internal medicine. The examiner said, "I think it directly relates more than most of what we do in the medical course to your job as an intern. Along with the quote, essentially that's what we do day in and day out, is do a long case or medium long case with almost every patient we meet. Another examiner was quoted as saying, I think it is the best yardstick against which to measure a student's performance as a practicing doctor. Needless to say that this study concluded that the long case was an important assessment for all medical schools, despite its flaws. So the Division of Internal Medicine at UWA are dedicated to keep the long case as a cornerstone of medical student assessments within our discipline. We have a longitudinal approach to the assessment of this skill in the 3 clinical years of the MD program. In your preclinical time, you'll be taught the framework of how to take a history and the various components of that history. For example, history of presenting complaints, past medical history, family history, medications, and so on. You'll also be taught how to perform the key physical examinations. Then when you commence your clinical years, firstly and second year, the major internal medicine assessment will be the observed case presentation. The observed case presentation involves 20 minutes to take a history and then 10 minutes to perform a focus examination on the appropriate system for the patient you've just seen. All of this will be observed by an assessor. You will then have 5 minutes to gather your thoughts and then present the patient to the assessor. The focus in second year is on history taking and presenting an organized history and examination with the generation of a simple problem list. It is one of the few times in the medical school that you'll be observed taking a full history with a patient. In third year, we then have a long case assessed as one of the assessments in internal medicine. This will involve spending 1 hour with the patient unobserved and unknown to the student. You will take a full history and a full examination, then have 10 to 15 minutes to gather your thoughts together. Then the student presents the history, examination, and formulation to the assessor with a prioritized problem list. By this stage, you should be pretty skilled at eliciting a history and presenting it in an ordered fashion with critical thinking incorporated within it. The beginnings of a management plan should also be demonstrated with initial investigations and treatment. In final year, the long case becomes the key assessment in internal medicine and follows a similar model to the third year long case. Except by this time, you should be proficient in history taking and examination so that the assessment should be more focused on the problem list, including a reasonable differential diagnosis and management plan, including an investigation plan and interventions. I'm hoping that this brief description will give you some idea as to what the long case is, how important we feel it is, and how internal medicine at UWA will teach and assess you longitudinally over your 3 clinical years. Don't forget that the long case is a skills exam, where the skill is in your ability to elicit history, perform an examination, and formulate a management plan. Just as with any skill, the way you improve this one is by practicing. So you need to see lots of patients and spend time with them without reading their medical notes or listening to other people's thoughts on what is going on with them until you've completed this skill. Future episodes in this long case series will include watching an expert do a long case and watching some early career doctors presenting long cases, followed by a critique of their performance. So stay tuned for more, and I hope you have a good day. Thank you.